Good afternoon. Welcome everyone to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll. And I am here. Everyone is present. Good afternoon, everyone. We have several agenda items today. We will have a work session on Senate Bill 41, 42, 177, 221, 109, 237, and 239, and 297. And then we will have a hearing on Senate Bill 255, 315, 317, and 390. Our goal is to do work session first, then we'll have Senator Buck present on her bill, and then we'll move on to Senator Scheibel. I do have a few housekeeping items for everyone that's here present. We do have a very long agenda, and so I want to make sure that I reiterate these comments as we're moving forward. So just as a reminder, agenda items can be taken any order based on the encounters today. If you do have public comments, we ask them that we please keep them to 2 minutes each. We want to make sure that as many people get the chance to speak on all the bills that we're presenting today. So let's make sure that we're keeping in a timely fashion. For the sake of time, we are going to be limiting testimony for each hearing to 30 minutes. So that's support, opposition, and neutral will each get 30 minutes. So just giving that as a heads up for all the bill hearings today. You can also, if you aren't able to speak within the 2-minute mark, you can always send your committee remarks to our committee staff. If you wish to testify, you can always sign in at the table by the door. And if you do not wish to testify, you can also sign in so we can keep track of you for our minutes purposes. When testifying, please turn the microphones on to speak and off to listen. And last but not least, of course, we ask everyone to please turn off their electronic devices. So let's go ahead and proceed with the work session. So we'll start with the work session from our committee policy analysts. So we'll start first with Senate Bill 41. So Ms. Cooper, please proceed.
Thank you, Chair. Destiny Cooper, Research Division, Policy Analyst, Legislative Council Bureau. As nonpartisan staff, just for a disclaimer, I cannot support or advocate for or against any measures you will hear before you today. And we will move forward to Senate Bill 41, which was heard on March 2nd. Senate Bill 41 requires the Division of Child and Family Services of the Department of Health and Human Services to award categorical grants to agencies that serve a county with a population of over 100,000. An agency is required to submit to the division a description of the specific goal it aims to achieve over the upcoming biennium, or an estimate of the percentage of the goal that will be achieved. A child welfare agency that receives the grant must use the money allocated to achieve a specific goal, and there is no restrictions on how the remainder of the money may be used. Similar information is to be reported to the governor and the legislature. And lastly, this bill requires the Joint Interim Standing Committee on Health and Human Services to study issues related to funding of agencies that provide welfare services and the effects of reductions to rates of reimbursement under Medicaid. There was an amendment proposed by the Nevada Association of Counties. The proposed conceptual amendments are attached, but in summary, the amendments provide authority for the state to administer the grant as a categorical annual grant instead of as an incentive grant, to base this process off the fiscal year rather than the calendar year, to change the timeline of reporting the progress to the governor and the legislature to 60 days from year end after the submission of the improvement plans, and lastly, adds factors and additional topics to be addressed and studied by the Joint Interim Standing Committee on Health and Human Services. Chair?
Thank you so much. At this time, committee members, do we have any questions?
Move approval.
Thank you so much. We have a motion from Senator Stone. Do we have a second?
I'd second.
Second from Senator Vice Chair Nguyen. Any comments? Any discussion? Oh, Senator Titus.
Thank you, Mr. Chair. I will vote this out of committee, but I'm just now looking at these amendments. I want to make sure that I'll be okay with amendments in the long term, but I will vote yes today with the caveat that I have to absorb this amendment.
You got it. Thank you so much. Any other comments or questions? Seeing none, all those in favor for this motion, please say aye.
Aye.
Any abstentions? Any opposition? With a motion of 5-0 to 0, this bill will continue forward. And that was amend, do, pass, and I will assign that floor statement to myself. Let's move on to Senate Bill 42. Ms. Cooper?
Thank you. Destiny Cooper, LCB, Research Division. Senate Bill 42 was heard on February 21st. It authorizes the Board of County Commissioners in a county whose population is 100,000 or more to use county funds for medical assistance to indigent persons for certain Medicaid supplement payment programs to A, provide an enhanced rate of reimbursement to any public hospital in the county for hospital care that is provided to Medicaid recipients, and make supplemental payments to these hospitals for the provision of such hospital care through increased federal financial participation. There was an amendment proposed by Joanna Jacobs, Government Affairs Manager, Clark County, and the proposed amendment can be summarized as follows. Allows contributions to any program approved by any other program by the Federal Centers for Medicare and Medicare Services. Thank you.
Thank you so much. Committee members, any questions on this bill? Senator Stone?
No questions, happy to move it.
Thank you so much. We have a motion to amend and do pass. Do we have a second? Second from Vice Chair Nguyen. Any questions or comments? Seeing none, all those in favor, please say aye. Aye. Any opposition? Any abstentions? Motion carries with 5-0-0. I will go ahead and assign that to Senator Lane for, and again, that was amend and do pass. Let's move on to Senate Bill 109. Ms. Cooper.
Destiny Cooper, Research Division, LCB. Senate Bill 109 was heard on March 16th. It authorizes a coroner or medical examiner to release the removal of a body or body part in the event of brain death for the purpose of transplantation if it is a valid anatomical gift and there is no communication of refusal. This bill also authorizes a procurement organization to position the court to appoint a person to make an anatomical gift on behalf of an individual if no authorized person is available. There was an amendment proposed by the Nevada Donor Network, and the proposed amendments can be summarized as follows. I just want to put it on the record that there was an additional amendment that was added after the packets were printed that can be found on Nellis, and it can also be found by the front door. And then members, you should all have a copy of the most recent amendment. The amendments summarized: amend Section 1, Subsection 3, adding additional coroner and medical examiner provisions. Add Subsection 4, removing criminal and/or civil liability for any act or omission with respect to complying to the provisions of this section. And lastly, amend Section 5, replacing language of who has authority to dispose of the descendant's body. Just as for the record, the intentions of these amendments were to satisfy the concerns regarding the process for the coroner or medical examiner to authorize an anatomical gift if there is no evidence that the deceased did not want to be a donor and them being held liable for their decision. Thank you.
Thank you so much, Ms. Cooper. Questions from any committee members? At this time, I will go ahead and entertain a motion to amend and do pass. We have a motion from Vice Chair Nguyen. Do we have a second? Second. We have a second from Senator Lang. Any discussion? Senator Titus.
Well, thank you, Mr. Chair. I will be an absolute no on this bill. My concern with this bill, although well-intended, and we certainly need to reach out to our public regarding donations of anatomical gifts. My concern with this bill is that it potentially does a disservice to the people that we're trying to protect in so many ways, and that would be the people who don't have IDs, and that would be our undocumented and our homeless. And those are the folks we may not be able to find out where they're from, may take a long time, and not be able to reach their nearest family. And so I think that's who we're really targeting in this bill, and unfortunately I cannot support it. Thank you.
Thank you, Senator Titus. Senator Stone.
Thank you, Mr. Chair. And I also want to thank the proponents of this bill for coming in and exemplifying the importance of harvesting organs and getting more donors, because we have people, unfortunately, that are in a supply line that aren't being able to live because they're not getting the organs in time. But I do share some of the same concerns that my colleague, my rural county doctor friend, that has talked about the disproportionate effect that this could have on people that are unidentified, namely homeless people and undocumented people. Because you only have a certain amount of time to harvest these organs. It's about 72 hours before the organs are no longer viable anymore. And I just don't think that that gives enough time to locate the next of kin or somebody that knew the unfortunate person that was brain dead to get their their organs. I think it also places our coroners in a medical ethical dilemma upon the request of a procurement organization for the brain dead subject's organs. Every human being has the right to decide if he or she wants to give an organ. While the benefit of receiving organ donations is understood, every person deserves the right to affirmatively donate their organs, but the absence of such documentation or knowledge should not be defaulting to a yes. So I'm hoping that we can work with the proponents in better educating the public about the importance of organ donation so we can increase these important tissues. But in its present form, unfortunately, I can't support the bill.
Thank you so much. Any other comments before we go to the vote? Once again, the motions for amend and do pass. All those in favor, please say aye. Aye. Any opposition? Nay. We have opposition from Senator Stone and Senator Titus with a vote of 3-2. The motion carries, and I will go ahead and assign that to Senator Nguyen. Ms. Cooper, let's move on to Senate Bill 177, please.
Thank you, Chair. Destiny Research Division, LCB. Senate Bill 177 was heard on March 2nd. It codifies an existing requirement that Medicaid must cover antipsychotic and anticonvulsant drugs under certain circumstances and extends the requirement to health maintenance organizations and managed care organizations that provide coverage to recipients of Medicaid. Additionally, this bill authorizes the Commissioner of Insurance to penalize those who do not comply with these provisions. Chair?
Thank you so much. So at this time, I will go ahead and entertain any questions. Seeing none, I'll go ahead and entertain a motion for do pass on Senate Bill 177.
So moved.
We have a motion
Second.
to do pass from Senator Ling and a seconded from Senator Stone. Any discussions on this bill? Senator Titus.
Thank you, Mr. Chair. Again, unfortunately, I have to be a no on this bill. I think that the bill, although well-intended, will also have unintended consequences. What this bill really should have done is if I have a patient that's on a medication and it has worked for them and they change formularies, this bill really should have said that they have to be able to stay on that formulary. Opening this up to allow and mandate that then they have to provide any other drug that the prescriber may prescribe when there's alternatives to that. I just can't accept that. I think the cost is going to be relatively prohibitive, and I think the bill's well-intended but misguided.
Thank you so much. Any other comments on this bill? Once again, the motion is for do pass on Senate Bill 177. All those in favor, please say aye. Aye. Any opposition?
Nay.
We have an opposition from Senator Titus. Any abstentions? Motion carries, and I'll go ahead and, for do pass, I'll go ahead and assign that to Senator Nguyen. Senate Bill 221, Ms. Cooper.
Destiny Cooper, Research Division, LCB. Senate Bill 221 was heard on March 14th. It requires the Division of Healthcare Financing and Policy of the Department of Health and Human Services to establish a billing category for special clinics that treat children with cancer and other rare diseases. Additionally, this bill requires DHHS to create a billing guideline and a rate methodology for these clinics for reimbursement purposes. Chair.
Thank you so much. Any questions on this bill? Seeing no questions, I'll go ahead and entertain a motion to do pass Senate Bill 221. We have a motion from Senator Titus and a seconded from Vice Chair Nguyen. Any discussion on this bill? Seeing none, I'll go ahead and call it for a vote. So this is for do pass Senate Bill 221. All those in favor, please say aye. Aye. Any opposed? Any abstentions? Motion is carried, and I'll go ahead and assign that to Senator Stone. Let's go ahead and move on to Senate Bill 237. Ms. Cooper.
Destiny Cooper, Research Division, LCB. Senate Bill 237 was heard on March 23rd. It transfers a regulation that impose a surcharge on telecommunication lines supporting behavioral health crisis services from the Division of Public and Behavioral Health of the Department of Health and Human Services to the Public Utilities Commission of Nevada. The commission is required to collect a surcharge of 35 cents on certain mobile communication services, IP-enabled voice services, landline telephone services, including trunk lines, and deposit the proceeds into the crisis response account. Finally, the bill declares any regulations adopted by the State Board of Health relating to the surcharge to be void and instead requires the commission to adopt regulations. There was an amendment proposed by Senator Harris. It can be found attached, and it can be summarized as follows. retains the authority to assess the surcharge with the State Board of Health, thereby allowing the board to promulgate regulations and adjust the surcharge, in addition to removing the ability to assess the surcharge on the branch of a trunk line. It adds that a surcharge is to be remitted to the division before the end of each month, requires relevant companies to report information to the department, removes sections 2 and 3, and clarifies that the surcharge can be used for crisis stabilization centers. Thank you.
Thank you so much. Do I have any questions from the committee? Seeing none, I'll go ahead and entertain a motion to amend and do pass Senate Bill 23. We have a motion from Vice Chair Nguyen. Do I have a second? We have a second from Senator Lang. Any discussion? Senator Titus.
Mr. Chair, I was semi-okay with this bill until the amendment. I brought up during the hearing that this bill, why was this bill not a two-thirds, as it was a two-thirds bill originally? It was stated that because it made no changes other than clarification on what lines could be billed. With this amendment, you're now adding provide for an adjustment in the surcharge every 5 years. I strongly protest that without it being a two-thirds bill. So I'm going to be a no on this. Thank you.
Thank you so much. Any other discussion points? Okay. Again, this is Senate Bill 237. The motions amend and do pass. All those in favor, please say aye. Aye. Any opposed?
Nay.
We have a nays from opposition from Senator Titus and Senator Stone. Motion carries. We will go ahead and assign that floor statement to Senator Nguyen, if that's fine. And we're going to skip SB 239. That's the last one, but we'll go to Senate Bill 297. Ms. Cooper.
Destiny Cooper, Research Division LCB. Senate Bill 297 was heard on March 23rd. It authorizes the School of Medicine from both the University of Nevada, Reno and the University of Nevada, Las Vegas, in collaboration with the Department of Health and Human Services, to establish the Nevada Memory Network. Additionally, this bill makes an appropriation of $684,573 from the State General Fund to the Nevada System of Higher Education to support the establishment of the Nevada Memory Network. There was an amendment proposed by Senator Doniate, and it replaces the term community-based dementia care navigators with community health workers that specialize in dementia to prevent the creation of a new title or position. Thank you.
Thank you so much. Committee members, do we have any questions? At this time, I'll go ahead and entertain a motion to amend and do pass.
Also move to amend and do pass.
We have a motion from Vice Chair Nguyen. Do we have a second? Seconded from Senator Lang. Any discussion? Senator Titus.
Thank you, Mr. Chair. I'm going to be a no on this one also, although I appreciate the clarification on what a community-based dementia care navigator is. I still remain concerns about the ability to stand up this clinic, the lack of resources, and that I think it's going to be draining our resources, not actually augmenting them. So unfortunately, I'll have to be a no. Thank you.
Any other discussion points? Once again, the motions amend and do pass. All those in favor, please say aye. Aye. Any opposition?
Nay.
We have a nay from Senator Titus and Senator Stone. The motion is carried, and I will go ahead and take the floor statement on this one. Senate Bill 239, Ms. Cooper.
Destiny Cooper, Research Division, LCB. Senate Bill 239 was heard on March 14th. It authorizes a patient under certain circumstances to self-administer a medication that is designed to end the life of a patient, and authorizes a physician to prescribe such a medication if the patient meets certain criteria. This bill outlines requirements concerning the manner in which a patient may request and a physician may prescribe and dispense a medication designed to end the life of the patient. Among other things, this bill requires an attending physician who prescribes such a controlled substance to include certain information in the patient's medical record and provide certain information to the Division of Public and Behavioral Health of the Department of Health and Human Services. The division is to review and compile these reports, including data concerning the implementation of the provisions of the bill. Amongst other provisions, there was an amendment proposed by the Compassion and Choices Networks, and it can be summarized as follows. It authorizes a coroner or coroner's deputy to investigate these deaths, but does not require them to. Additionally, adds language that protects local governments, coroners, and law enforcement employees from civil and criminal penalties for investigating these deaths when there is no underlying cause of death. It clarifies the manner of death cannot indicate a suicide, replaces the term mental competence with mental capacity, removes the section defining physician assistants as practitioners, excluding PAs from being able to prescribe the end-of-the-life drug, in addition to added language referring to professional associations. It adds a new section that excludes deaths resulting from exercising the provisions of this bill from the definition of a suicide. Thank you.
Thank you so much, Ms. Cooper. Any questions from the committee members on this bill? No questions? Okay. We're going to go ahead and move on. I'll go ahead and entertain a motion to amend and do pass Senate Bill 239. We have a motion to amend and do pass from Vice Chair Nguyen. Second from Senator Lang. Any discussion? Senator Titus.
It probably comes as no surprise that I'm going to be a no on this bill for a number of reasons. I do appreciate listening to my concerns and clarifying the coroner possibility of investigation. But that doesn't really clarify what I, as a provider, could put down as the definition of end of life. And certainly, whether or not they chose to take their own life should be part of the documentation. You can also add the underlying disease process, but I think it really tends to skew outcomes and some of that data, and that's just one of the many reasons I'll be a no on this bill. Thank you, Mr. Chair.
Thank you, Senator Titus. Senator Stone.
Thank you, Mr. Chair. And again, I want to thank the proponents of this bill. I mean, obviously, as a healthcare provider, the last thing that Dr. Titus or I want to do is make anybody suffer. But I believe that we have a medical armamentarian that's out there that can alleviate suffering when it's administered by the appropriate medical personnel. This is not my first rodeo with this bill. This is something that I studied attentively in my prior tenure as a California state senator. And what I discovered is things that I did bring up during the hearing. I just want to summarize that there were many botched suicides where a physician was not present, family members were there, and sometimes the suicide took not hours, but sometimes days to accomplish. Also, it may give insurance companies a reason not to cover an expensive drug that may have some efficacy, some new efficacy, and let's say treating in some cancers. And I was witness to some letters, and I'd be happy to give it to the committee for documentation, where an insurance company basically said to a lung cancer recipient that we're not going to pay for this expensive medication, even though it could give you 30% potential efficacy of living, but we will pay for the suicide cocktail. And I just thought that was rather alarming. Also, if you look at section 35, it says, it's a definition, death resulting from the self-administration designed to end the life of a patient is not suicide or assisted suicide. And my question is, if it's not that, then what is it? And then one thing that I had mentioned during the hearing is that there were many instances of coercion. And one of the proponents of the legislation that was testifying said in 25 years there was not any documentation of coercion. And I can tell you that there is. I'll just mention one case, and I'm not going to go into a lot of details. Mrs. Kate Cheney, as you can Google her, and you can see the case where this woman not only had a terminal illness, but she had dementia. And her own psychiatrist said that she was not in a position to make a decision like this. And what they did was they doctor shopped until they found a doctor that said that she could be cognizant of agreeing to physician-assisted suicide, but there's significant coercion by her daughter. That's also in the public record as well. So I just don't think there's enough protections in place. I believe that we have the medical armamentarian to take people out of their misery, and for those reasons, I can't support the legislation today. Thank you, Mr. Chair.
Thank you so much, Senator Stone. Any other comments? I just want to take a point of personal privilege. I think this is I during the hearing, I shared some alarming remarks as to how the bill was structured, and perhaps it didn't make sense to our state. And so we wanted to make sure that the amendment was sort of reflective of that. I think it's a important conversation for all of us. And there were portions that did not make sense. And, at the bottom line, philosophically, where we stand, it's important to make sure that, this is done in a controlled and right way. And the bill will go through other iterations as well, but I just want to thank my colleagues for any input that they suggested, either for or against or any particular circumstance. And I really am appreciative of all their sentiments. Once again, the motion is amended to pass, so we'll go ahead and go on to the vote for Senate Bill 239. All those in favor, please say aye. Aye. Any opposition? We have an opposition from Senator Stone and Senator Titus. The motion is carried, and I'll go ahead and assign this bill to Senator Flores. That concludes our work session for today. We will now progress on to the other portions of the agenda. We're going to move on to Senate Bill 255. It's an honor to welcome Senator Buck to Senate HHS, so please proceed when you're ready.
Good afternoon, Chair Donate and members of the Senate Committee on Health and Human Services. My name is Carrie Buck, and I represent State Senate District 5 in Clark County. Thank you for the opportunity, Chair Donate, to present Senate Bill 255 before you today. This bill requires the Department of Health and Human Services, or DHHS, to identify services that treat diseases that predominantly affect children, including pediatric cancers, and seek an increase for Medicaid reimbursement rates. Pediatric physicians, like many other physicians in the state, are facing increased patient volumes and facing challenges getting children and families in need access to quality and timely health care. These shortages force families to travel long distances, join wait lists that can sometimes be months long, or avoid getting care or treatment altogether. For example, according to the American Academy of Pediatrics, about 21% of Nevadans must drive at least 80 miles to get to the nearest pediatric subspecialty adolescent primary care. 23% of Nevadans must drive at least 80 miles to reach a pediatric allergy or immune specialist, whereas nationwide, this is only true for only about 6% of the population. The American Board of Pediatrics states that there is roughly one developmental behavioral pediatrician for every 698,748 children. That's 0.1 per 100,000 children. One potential barrier is that not only do we not have enough pediatric specialists in our state to provide care, but the ones that are here can only provide limited services due to the low Medicaid reimbursement rates. Medicaid reform is the top priority on the healthcare financing agenda. Medicaid reimbursement continues to be a barrier to equity and access for low-income families. Medicaid reimburses at rates lower than Medicare and commercial rates, disincentivizing providers to care for lower-income families. Over 191,000 low-income children in Nevada rely on Children's Health Insurance Program, or CHIP, for access to quality health care. When pediatricians and Medicaid have a disconnect, the consequences fall on children, creating additional barriers to quality health care at an affordable price. With low Medicaid reimbursement rates in place, the burden not only falls on children seeking care, but on the providers that are expected to provide the care. The low reimbursement rates continue to cause physicians to turn away Medicaid patients due to the simple fact that their practice cannot afford to provide the expensive services for such low rates. The result of fewer physicians means increased wait times for urgent appointments, sometimes even pushing families out of the state to get the care they need. More reasonable provider payment for care is necessary to ensure that low-income children in our state have the same access to health care as those of Medicare or commercial insurances. The intentions of this bill are to increase the rate of reimbursement for specific diagnosis and services by 10% for each service. Not only will this benefit the youth in our state, but it will increase the number of pediatric specialists practicing in our state, fueling the healthcare workforce. So let me take you through the bill quickly. It's a short one. Section 1 of the bill requires the Department of Health and Human Services to determine which services under the Nevada State Plan for Medicaid are provided to children with rare diseases or pediatric cancer. Section 1 also requires that DHHS appeal to the Federal Secretary of Health and Human Services to amend the state plan to increase the rate of reimbursement by at least 10% for the services identified in the first part of Section 1. Section 2 makes the bill effective upon passage and approval. I do want to direct you to the brief conceptual amendment. In summary, this amendment will require DHHS to determine which diseases impacting children have a significant shortage of specialists to treat them. Broadening it from the original bill that only applied to rare diseases and pediatric cancer. The ratio of patient to specialist is to be included in this along with wait times. The Medicaid payment rates for where these shortages exist will be increased by 10%. Now I'm going to turn it over. I believe we have Ann Logan, the CEO and founder of the Cure for Kids Foundation via Zoom. And I also have one of 5 in our entire state gastroenterologists. I practice that, but in the state. And so Dr. Barron, would you please come join me? And I'll turn it over to you, Annette.
Thank you. Hi, everyone. Thank you for allowing me the opportunity to present on this important topic today. It's an honor for me to represent the medical needs of Nevada's children in this process. I'm Annette Logan Parker, founder and CEO of Cure for the Kids Foundation, as well as the chair of the Nevada Rare Disease Advisory Council. I'll start off with giving a little bit of a background on Cure for the Kids Foundation. So we were established in 2007 as a tax-exempt organization, primarily to recognize children with cancer and other rare diseases and the lack of services that they had available to them 17 years ago in Southern Nevada. We have a multidisciplinary approach, and we employ many pediatric subspecialists. So we primarily offer pediatric oncology, hematology, pediatric orthopedic surgery, genetics. We have a pediatric physical therapy program, a lot of different bleeding and clotting disorder clinics and specialty clinics for sickle cell patients, and bringing on pediatric rheumatology in the very near future. So we have a robust program. We see about 125 kids a day, which equates to roughly 6,000 unique patients every year. So it's a very large organization, and we treat the majority of children in the state of Nevada that have cancer and other rare diseases. And then for those of you who are unfamiliar with the Nevada Rare Disease Advisory Council, the RDAC was established through Senate Bill 315 in 2019. And the RDAC was established to help bridge policymakers' gaps in knowledge regarding rare diseases. For reference purposes, all childhood cancers are considered rare, and there are over 7,000 identified rare diseases that impact approximately 10% of the American population. And we serve as an advising body and liaison between the rare disease community and state government. So today I'm here in support of Senate Bill 255 and with the purpose of the bill to amend the Medicaid Services Manual as described by Senator Buck. One of the things that I really want us to focus on and understand is having Medicaid coverage does not always translate into getting the care needed in the Nevada pediatric subspecialty environment. It's no secret that for many years, families with children enrolled in Nevada Medicaid have experienced difficulties finding pediatric specialists willing to accept them into their practice. The subspecialty physician offices in Nevada have cited the only reason for limiting or not accepting children with Medicaid is consistently inadequate payment for services. Children with cancer and other rare diseases and serious conditions with Medicaid, particularly the fee-for-service piece of the Medicaid product, have serious access to healthcare challenges. The overall supply of physicians participating in Medicaid is not keeping up with the pace of growth within enrollment. As Senator Buck had described, Medicaid does not reimburse sufficiently to cover the actual costs of providing care for children with cancer and other rare and serious conditions. The physician payment rates for Medicaid have only increased approximately 5% over the last 20 years. Yet there are many studies that prove that the increase in the cost of delivering healthcare has, in some studies, as high as increase of 195%. That particular study was at USC School of Public Health. And what's I think we really need to talk about here is the rate methodology is not just a reduction in fees. Providers are actually being paid less than the cost of providing the care. And the delta between that is increasing more and more with our current staffing situation in the state of Nevada. Example, I can tell you at Cure for the Kids Foundation, we are paying healthcare professionals 35% more today than we did just 5 years ago. And so pediatricians simply cannot afford to see Medicaid patients. It has the potential to bankrupt them. And so as Senator Buck had said, the de-incentivized process that is happening with Medicaid beneficiaries is challenging when the reimbursement rate is noted at 30 to 35% less than Medicare's reimbursement. So the pediatric medical subspecialists who care for these patients require a considerable amount of additional training, and that training is not cheap. And since these highly specialized physicians are in very, very short supply, children and families face challenges accessing timely healthcare needs, and in often cases, they don't get the care that they need. Research has found that most pediatric subspecialists, including those practicing oncology, neurology, pulmonology, genetics, gastroenterology, and the list is long, do not see a financial return from the additional training that is required for them to even gain the credentials that they need to care for these children. And that is associated with the delay in receiving increased compensation and repayment for educational debt. So, you know, to put it in simple terms, the juice is just not worth the squeeze. The practice of medicine is a business, and in this case, it's bad business. Physicians simply cannot stay in the environment providing care when the cost of providing that is too high. I can share with you, Cure for the Kids Foundation was established as a tax-exempt medical facility, primarily because I knew that we needed to rely on philanthropy to raise the funds required to provide the level of care that these children deserve. And we cannot expect all pediatric specialists to start a tax-exempt organization because they can't afford to practice medicine any other way. There's a direct correlation between physician payment and access to care. There are multiple studies that the American Medical Association has provided, and I'm happy to provide a link or a QR code to the robust list of those studies. Just today, we had a 26-year-old patient who is post-transplant from a form of ALL, which is leukemia, who needed photopheresis due to renal failure. She'll need to have this done 4 times consecutively, approximately 4 times a year for the rest of her life. She has a Medicaid product, and today the hospital informed us that she will no longer be able to receive these services due to financial reasons. The cost of the drug is $3,000 every time, plus 3 hours of nursing care and supplies, and the administrative team that's required to schedule, bill, and collect and coordinate all of this. And the reimbursement rate from Medicaid is $500. So this patient will either be required to seek care out of state, and it is unlikely that we will be able to identify a facility, let alone get her there. Without the treatment that she needs, she will end up in kidney failure. And unfortunately, her current medical condition, based on the conditions that she has as a direct result of childhood cancer treatment, will keep her from that kidney donor list. So that's just one example of things that we face every day at Care for the Kids, trying to get these patients what they need. Example would be when we attempt to refer Medicaid patients out into the community for services that we do not offer at Care for the Kids Foundation. For example, concurrent care with a cardiologist, a pulmonologist, a gastroenterologist, all of which are specialists that children with cancer and other rare diseases need in order to address the toxicities of their treatment or comorbidities associated with their conditions. We always get resistance and often a straight refusal to accept the patient because our colleagues simply cannot afford to care for these patients and keep their practices open. When the cost to provide the care is greater than the reimbursement received for that care, it's no longer discounted care. It's not even free care. It's an expense, and it's an expense that our local healthcare system can't afford. These children might as well be undocumented. We have the same access to care issues with Medicaid patients as we do undocumented children. The state of Nevada must fund their Medicaid program. It is literally crumbling before our very eyes. We will not see a robust and thriving pediatric healthcare delivery system in Nevada until we pay our physicians a living wage. Their wages are earned through adequate reimbursement for the services they provide. It's unreasonable to expect physicians and the facilities that they work at to pay for these services as a cost of doing business. This particular bill is seeking a 10% increase for providers who care for our state's most vulnerable children, and they deserve it and so much more. I ask that you please support an increase in fees for these providers and facilities, and I can tell you the children of Nevada are depending on you. I'm happy to answer any questions. Thank you.
Thank you, Chair Dunyate and members of the Senate Health Committee. My name is Howard Barron. For the record, I'm a pediatric gastroenterologist in private practice in Las Vegas. I've been treating children for over 30 years, and I'm here in support of SB 255 with the proposed amendment, and appreciate the sponsor for expanding the bill to consider all pediatric subspecialists. This committee is fully aware of the low rates of Medicaid reimbursement and the extreme physician shortages in Nevada. For pediatric specialists, the situation is dire. Compared to the national average of 8 pediatric subspecialists per 100,000 population, Nevada has 3.3 per 100,000 population. As a pediatric gastroenterologist, I treat children with Crohn's disease, cystic fibrosis, cancers, genetic disorders, children who are dependent upon feeding tubes, parenteral IV nutrition at home, a wide variety of different disorders. And in fact, even just today, one of my patients with celiac disease family called my office complaining that they could not get into any local pediatric endocrinologist for 3 to 6 months. And this child has known Hashimoto's thyroiditis, which the diagnosis of which I made on her screening labs. I had to make a personal call to one of my colleagues, of which there are 3 in Southern Nevada, to try and get this patient in within the next couple of weeks so that she could get appropriate treatment for her thyroid storm. That kind of stuff happens literally every day. As one of only 10 pediatric gastroenterologists in the entire state, there's 2 up in Reno and 8 in Las Vegas, I see firsthand the long wait times parents have to get their kids in to see us. Because most of pediatric subspecialty services are provided to Medicaid recipients in our state, we often fail to compete with cities outside of Nevada when it comes to recruiting talent to the state. My practice is essentially 60% Medicaid. It took us over 10 years to recruit a 4th physician willing to come to Nevada to join our practice. SB 255 would provide a thoughtful review of the pediatric specialists that are in short supply in Nevada and help to ensure that Medicaid rates are adjusted to help us continue to serve Nevada's most vulnerable population with the quality and timeliness all Nevada patients deserve. Thank you for your time.
And Chair Donate, I also have Stacy Weeks and Kimberly Adams that are available with Medicaid in case the committee has any questions about that.
Thank you so much. We'll go ahead and entertain any questions from committee members at this time. Senator Lane.
Okay, so I have a few questions. So, when you talk about pediatric care, what is pediatric care? Is it 18 and younger? What is the age range?
So I can speak for our practice, it's 18.
Name for the record, please.
Howard Barron, for the record. In our practice, it's 18 and younger at Cure for the Kids. Annette can testify that they follow their pediatric cancer patients well into their 20s because there are certain tumors that are actually pediatric specific. An example would be Ewing sarcoma, which is a bone tumor. If one of the adult oncologists in Las Vegas gets a patient with Ewing sarcoma, they refer them to Cure for the Kids because they have the specialty expertise only in that facility to treat that particular bone tumor.
And Dr. Barron, I might say I really appreciate your care. You took care of my son. Excuse me. Does this include hospitals? Because I know we had heard testimony about hospitals and their Medicaid reimbursements, and would they be included in this bill, or is it just for physicians?
Carrie Buck for the record. I believe it's just for physicians. However, I'm willing to expand that if the committee so shall want.
I think we heard testimony earlier this week or last week that how important it was that hospitals are not getting the reimbursements that they need. And so I just think that that's something that you should consider. And then I'll have another question later, but I'm good for now. Thanks.
Any other questions, Senator Stone?
Well, first of all, Senator Buck, thank you very much for bringing this forward. And to Ms. Logan, I'm always amazed when I hear you speak, and I'm always amazed when I see your dedication with Cure for the Kids. I was very fortunate to take a tour there, and the number of kids that you take care of is incredible. I applaud your efforts. So this bill is going to increase the Medicaid payment by 10%. What percentage of your clientele coming in now is either Medicaid or going to be Medicaid referred to another physician?
This is Annette Logan Parker for the record. Like Dr. Barron, our patient population of Medicaid is primarily, it toggles between 50 and 55%, sometimes as high as 60% of our entire patient population has a Medicaid product.
So obviously you're taking a lot of patients where you don't even receive the cost of providing that service back to you. And I know we've talked about this, that you've had some national celebrities that come here and do concerts and give a portion of the proceeds to your organization, which shows that there's not only a Nevada support from a philanthropic standpoint, but it's a lot of philanthropic organizations and people in Nevada support what you do because you're saving kids' lives. And I think nothing could be more important than that. And Dr. Barron, thank you. You're not only a physician, but you're a humanitarian because you're taking, like you said, 65% of your clientele is Medicaid, and we have one of the worst Medicaid rates in the entire country. And I strongly support this bill, Senator Buck. And it seems like a lot of the bills, Mr. Chairman, that we're hearing deal with this very low Medicaid rate. I know it's something that's very important to you in covering populations as well. And what's interesting is that, you know, for every dollar that we invest as a state, we get 3 more back from the federal government. And I always like that kind of a multiplier effect. So I know that we have limited resources in the state, but I hope, and I think it's a bipartisan desire, that we need to pump a bunch of money into Medicaid so we can get that federal match, so we can pay our hospitals more, so we can pay our pediatric oncologists more, so that we can attract more physicians that can come here and know they can make a living taking Medicaid patients. And so it enhances health care from all the way from Elko at the top all the way down to Laughlin at the bottom of this wonderful state. So this is a good start, Senator Buck. Thank you for bringing it forward. And again, thank you, Doctor, for being here. And thank you again. And I just want to mention one more thing. And like I'm one of the biggest cheerleaders for Cure for the Kids, Mr. Chairman, and one of the areas that they really need help on outside of this bill, I'm just going to mention it briefly, is the 420B program. There are so many hospitals that could buy oncological drugs for 10% of what this wonderful organization has to pay because they don't qualify for the 420B program. We need to find a way in which we can get them qualified so they can continue to give low-cost chemotherapy to their kids. Thank you very much.
Thank you so much. Any other questions? Senator Lang.
Okay, I have one more. Dr. Barron, do you think if we raise these rates, would these rates be competitive with other states around us? And do you think it increases the number of physicians that we can get come to Nevada, that we can have come to Nevada?
Howard Barron for the record. Yes and yes is the short answer. I think that a 10% increase on 60% of our patient population would allow us to recruit one or two more specialists into our practice and cut our waiting times from currently 6 weeks down to probably 2 weeks. And there's a pet project that I have, which is to provide some telehealth specialty care to some of the rural areas, which we've not really been able to stand up because we are so clinically busy with in-person patients in the big city that there's just simply no manpower to do that.
Great, thank you. I really like this bill.
Thank you so much. Vice Chair Nguyen?
Thank you. And this might be a question for Stacy Weeks. So I see her hiding behind there. Although you guys might be able to answer it. You had talked about the wait times. How would we be able to pull that data on wait times and specialists to patients? Are the providers providing that data for us? Like, how are we getting that? So maybe both of you could answer that in tandem.
Howard Barron for the record. So I happen to be, as an aside, I'm on the Insurance Commissioner's Network Adequacy Advisory Council, and we have been asking for data from the staff from DEI for the last 8 years that this committee has been stood up, and we're always told that we can't get wait time data. The group has a hard enough time meeting the CMS requirements for time and distance, which are really how network adequacy is currently identified in our state. So I think Ms. Weeks would tell you that we don't have access to that data through the Department of Insurance currently.
Mr. Chair, through you, Stacy Weeks for the record, Nevada Medicaid, through you to Senator Nguyen. Actually, in Medicaid, we could get access to data that we could try to make some conclusions about. We can look at referral dates for services and how long it takes for that child to actually get a billable service. So in Medicaid, I'm not quite for sure about Department of Insurance, but in Medicaid, we do have claims data that we can look at and try to make some inferences about wait time.
Is it actually accessible, or would it be like burdensome and require multiple data people we obviously don't have already? Or is it somewhere in between?
Mr. Chair, Stacy Weeks for the record, Nevada Medicaid, through you to Senator Nguyen. No, I think this is something we could definitely, it would take us some time, but we do have data analytics at the department. We have an Office of Analytics team. This looks like one study. It's not an annual study but it would take us some time to do it, but I don't think it's going to be a massive undertaking.
So just a quick clarification, in the amendment, by wait time, do we mean like, health administrator over here. When I hear wait time, I think of how many minutes has that patient waited in the waiting room. So what's the specification that you're setting for parameters?
So Howard Barron for the record. So I think what we would be talking about is time from initial referral for a subspecialty appointment to actually being in the office for that referral.
Thank you. That was helpful. Vice Chair Nguyen.
I like this.
For the record, I have some insight on that. Thank you. So Annette Logan Parker for the record. We do have some wait time statistics at Cure for the Kids that's available in a variety of different categories. So example would be, we are referrals for newborn screening, and we currently, as of this morning, had 49 patients on the wait list that haven't even made it to the scheduling queue. for newborn screening evaluations. Our genetics program has a wait list that's a year long. And currently we have 49 patients in the wait list to even be screened at Care for the Kids Foundation to be assigned to a physician. So that's just an example of one snapshot in time, but that's a significant number of potentially very ill children that are waiting for appointments.
Thank you so much. Vice Chair Nguyen.
I really like this bill. It's giving me a little deja vu from the one we just worked sessions with Senator Doñate and Senator Stone. So I'm glad to see that this is something that's important across the aisle and to our state. I have a question. I know that we obviously, in the increase of the 10%, would make a significant difference. And I know this kind of following up is the 10% does that bring us to a competitive rate, or I know we make up a lot of numbers here that sound good, or we round things up. So I'm wondering what the basis of that particular, how we landed on that percentage and not say 8 or 12 or anything like that.
Well, I can't, this is Howard Barron for the record. I can't speak for Senator Buck and whether she's a math genius or not. But I can tell you that when I last looked at the statistics on a heat map of the entire United States from state by state, states with our provider to patient ratio, such as Alaska, Montana, were for Medicaid reimbursement, they were averaging 1.16 times Medicare rates. Okay, our state currently provides about 0.8 to 0.85 times Medicare rates. So a 10% increase gets us closer, not quite to Medicare rates, but gets us closer. And Medicare rates, the hospitals will tell you, is their break-even point in providing the care. For us, it's probably a little better than that.
Any other questions? No? Well, Senator Buck, I do want to thank you, of course. It's an important conversation, and of course, to our your co-presenters. Let's go ahead and move on to testimony in support of Senate Bill 255. So any folks that would like to testify in support, please come forward, so that way we can fill the chairs, please. And Mr. Ross, whenever you're ready.
George Ross with Carrera, Nevada, on behalf of HCA, which is Sunrise Children's, Mountain View, and Southern Hills Hospitals in Southern Nevada. Many of you have visited Sunrise Children's Hospital. You have seen the NICU, you have seen the PICU, you have seen the serious illnesses those kids have, and you know from that most of them, or a great many of them, are either uninsured or on Medicaid. We are strongly support this bill. We strongly support that increase. We strongly support the calculation to figure out where the shortages are and what we can to add 10% more to their reimbursement. How big is this problem? This morning at the Medicaid meeting, as Director Weeks pointed out, there are 920,000 people in Nevada on Medicaid. 44% of those are age 0 to 18. Like another way to look at it, 55% of Nevada's births are Medicaid kids, and that doesn't count the undocumented. So this is a tremendously horrible problem that I just encourage you, because this bill will take a strong first step to trying to address this. At this moment, we've said over and over in so many words today, a gigantic situation where we have where we have a two-class medical system. Many of us are lucky enough to have insurance with relatively full networks. And then we have this large portion of the population on Medicaid. And I won't repeat everything you've heard today, because it's a totally different situation and incredibly inequitable. So number one, I'm incredibly encouraged, as HCA is incredibly encouraged to hear so many of you in support of this bill, and we strongly urge its passing. Thank you.
Good afternoon, Chair, members of the committee. My name is Will Pregman, for the record. That's P as in Peter, R-E-G-M-A-N, representing Battleborn Progress. We're in support of SB 255. We support measures that generally increase access and help Nevadans afford critical medical care through increasing the reimbursement rate for Medicaid for children with cancer and other such diseases. We think no child and their family should be left confused or doubtful that Medicaid can cover the illness that their child is experiencing. And we'd like to thank Senator Buck for introducing the bill, and we urge your support of SB 255. Thank you.
Thank you so much. Anyone else in Carson City? Anyone in Las Vegas? Please proceed.
Yes. Good afternoon. Good afternoon, honorable lawmakers of Nevada, ladies and gentlemen. For the record, my name is Dr. Philip Alaracio, a practicing dentist in Las Vegas since 2004. I am here to express my support to Senator Karibak, and I would like to express also my concerns about the lack or limited access to healthcare services for our Nevadans. This problem is compounded by lack of available physicians, dentists, nurses, and other healthcare providers. The retention of Nevada providers could be attributed to low fees or subminimal reimbursement for services rendered. In this manner, it will affect the quality and access of healthcare in our state. We all know that going to medical and dental school is cost prohibitive. Young generations does not wish to start their life with more or less than $500,000 student loan. With the present reimbursement status for any providers, this becomes an attractive state to make a living for the doctors and other allied healthcare providers. I remember many physician friends expressing their dismay about the $20 to $30 reimbursement per patient visit. The same situation applies to us as dental practitioners in Nevada, working or under the Medicaid programs. From low reimbursement to increased patient load wrapped by our litigious society, the quality of our healthcare is undeniably will suffer. With all of these few points I presented, may I ask all of you to support our healthcare workers. We would like to create a healthy Nevadans. Always remember, healthcare providers saves lives. Regardless or any reasons, healthcare providers makes a great difference in our lives. Thank you, and thank you for introducing this bill, Senator Buck. Thank you.
Thank you so much. Next person, please, in Las Vegas.
This is going to be the quickest one I've given you. First of all, my name is Susan Profit, and I'm the Vice President of the Nevada Republican Club. And I would first like to thank all of you for your service, and particularly today, Carrie Buck. This is a very good bill and very well written, and I can understand it without a lawyer. Kudos to you for that. And it's very much needed. And I have to say that I agree with everything the doctor just said. And I have firsthand experience with our medical facilities and what's available. And, you know, I am not indigent. But I was assigned to a pediatrician when I went on Silver State Insurance because there wasn't a doctor that could take care of a senior citizen with disabilities, okay? So I'd really like you to address those issues because we have a real lack of that, and I thank you for your time.
Thank you so much. Anyone else in Las Vegas? Let's move on to virtually in support.
Thank you, Chair. If you'd like to testify in support on SB 255, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in support at this time.
Thank you so much. Let's move on to opposition. Is there anyone here in Carson City? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in opposition on SB 255, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you so much. And let's move to neutral. Is there anyone in this room for neutral? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in neutral on SB 255, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you so much. Senator Buck, did you have closing remarks?
Just Carrie Buck for the record. My son was had bloody noses and was sent to Cure for the Kids. And I have to be honest with you, I was scared to death. And I looked around the waiting room and I thought, oh my goodness, how lucky I am to have the insurance and the means to be able to take care of him. But what if you don't? And so I definitely want to be a champion for these children to get them the necessary care that they can. And so thank you so much, Chair Donate, and the rest of the committee for hearing my bill, and thank you for considering SB 255.
Thank you so much, Senator Buck. We greatly appreciate you joining us, and of course, we know this is an important issue. And all right, we'll go ahead and close hearing on Senate Bill 255. Let's move on to Senate Bill 315. I will go ahead and open a hearing on this bill. This bill makes revisions relating to the rights of persons with disabilities and persons who are aged. We have with us Senator Scheibel for Scheibel Days. So we have a couple of bills. We originally had more scheduled, but we're ready when you are.
Thank you, Chair Donate, and yes, thank you for scheduling all of my bills today for Scheibel Day. I'm very pleased to be here presenting you with SB 315, but really I will not be presenting it to you because some people who are far more versed in this issue than I am are going to explain the bill to you, starting with my intern from UNR, Aaron Schaefer, who will walk us through the bill, and then Eric Jimenez will provide some background and details, and we also have Santa Perez with us to speak to the importance of the bill, and the three of us will be here to answer questions. The three of us will be here to, four of us, there are four of us, I can count, we'll be here to answer questions.
Hi. For the record, my name is Erin Schaefer, E-R-I-N-S-H-A-F-F-E-R, and I'll be providing some background information and some amendments for this bill. So this bill takes tremendous steps in protecting the rights of people with disabilities and people who are aged by establishing the Bill of Rights. It ensures the right to bodily autonomy by protecting an individual's ability to make decisions that affect their life, including decisions regarding personal property and finances, location of residence, and the development of a home and community-based care plan. While receiving services from a home and community-based services waiver, this bill also guarantees an individual to be treated with dignity and respect, live in a safe and sanitary environment that allows for reasonable privacy and independence, have access to adequate nutritious food, protect or practice the religion of their choice or abstain from the practice of any religion, receive timely health care, have access to educational rehabilitation and recreational opportunities, and select a family member or advocate to enter into a supported decision-making agreement, among other things. This bill also establishes the Bill of Rights for pupils with disabilities. With many of the same guarantees from the aforementioned Bill of Rights, this section also provides assistance and counseling concerning higher education and allows for education and financial literacy in the Nevada ABLE Savings Program. Within this bill, there's an amendment attached to it. This amendment can be found on Nellis, and a copy has been provided to each committee member. The amendment clarifies and makes changes to the following. This amendment clarifies the Bill of Rights for persons with intellectual, development, or physical disabilities or who are aged, which is outlined in Section 1 of the bill, only applies to existing services provided through the Home and Community-Based Services Waiver. Section 1, subsection 2G, is revised to clarify the extent that certain ancillary services would fall under the provisions of this bill. It refines Section 3, thereby establishing the Transition Bill of Rights for peoples with disabilities. This would apply to older children with disabilities who are also receiving transition services through an Individualized Education Plan, also known as an IEP. And lastly, this amendment makes various changes in Section 3, subsection 2, to outline the various rights afforded to individuals under the new Transition Bill of Rights for Pupils with Disabilities. For pupils with disabilities who are enrolled in public school or are receiving special education services, this Bill of Rights guarantees autonomy and equal opportunity in all aspects of life. Thank you.
Quick question, just to make sure we're on the same page. The amendment that you reference is the one sponsored by the Nevada Governor's Council on Developmental Disabilities? No? Yes?
No. Mr. Chairman, Eric Jimenez for the record. It is the one that is proposed by me, which I think is at the bottom of the 5 exhibits.
Okay, that's the one that you guys are referencing right now. Okay, thank you so much.
And real quick, thank you for that, Ms. Schaefer. Eric Jimenez for the record. I want to just give a little bit of background to the committee on kind of how we got here. As many of you know, I have been a huge advocate over the last decade in this building for how can we strengthen existing programs and services to really advocate for systemic change for Nevada's largest minority group, which is people with disabilities. And while we all tend to care about them, I think sometimes because they don't have lobbyists, they get forgotten in some of these important conversations. We have tremendous federal laws like the Americans with Disabilities Act, the Individuals with Disabilities Education Act, that provide baseline federal protections for people with disabilities. But oftentimes when it comes down to our federal agencies, those become box-checking exercises and paperwork exercises, and they don't really take into account the monumental strides that we've made in disability rights over the last 40 or 50 years. This bill came from the community. It largely came from a promise I made to Regent Sam Lieberman, who sadly is no longer with us, that we would find ways to strengthen the services that are provided through our Medicaid Home and Community-Based Services waiver and for our kids in the school system. This bill is modeled after 2 states. The state of Ohio has a Bill of Rights for people with developmental disabilities, and the state of Massachusetts has furthered that. Thanks to the work of so many state agencies and stakeholders, the amendment that we're presenting to you today, I think, goes a long way in helping to advance these rights for folks. One, it increases the person-centered rights that are provided through the Medicaid Home and Community-Based Services waiver. So instead of just providing services to an individual, institutionalizing them in a traditional sheltered workshop, as many of you know, there's been a robust conversation this legislative session and in sessions past on how we can get people with disabilities not to be in those institutionalized settings, how we can have them have competitive integrated employment within the community, how they can pursue higher education, join a trade, graduate with an alternate high school diploma. And some of our existing Medicaid services don't really take those into account. So what this would do, it would state a prominent statement from the legislature that says when we're providing Medicaid services under the waiver, we're going to keep the person in mind first. And that may differ from things we've done in the past, but I think it will go a long way in improving services and telling people they don't have to be institutionalized or they don't have to settle for less. They can choose what kind of care they get. They can voice grievances if that care is not what they think it is. And their families and themselves can be rest assured that they can have a little more ownership in what that care looks like. Part 2 of this bill, which you will see in Section 3, I think it differs from some of the other states who have similar bills of rights. And we thought if we're providing this new kind of concept of how we provide disability services in the state, how can we start that conversation earlier with kids? We have federal protections, as I mentioned earlier, through the IDEA. Those protections are largely available to parents since kids are so young in the school system that they're not making decisions for themselves. In conversations with the wonderful team at the Office of Inclusive Education at the Department of Education, we've come up with a transition Bill of Rights. So the idea here is when a child reaches about age 14 and they're starting to think about what do I want to do with my life, maybe I want to go to college, maybe the traditional education model is not working for me because I have a disability, and I want to work with my IEP team to figure out, what's my path forward? How can we strengthen the rights that are available to students and also provide them with some ownership in what they want their life to be like? Broadly, we haven't done this before. This is one of the largest disability bills, even though it's only 5 sections, that this state would consider, and I think it would have monumental effects on how kids and their families can start to move forward to a more independent future. And before we go to some of our advocates, I think the importance of this bill became even more apparent about 2 weeks ago. There was a 9-0 Supreme Court decision in Perez versus Sturgis Public Schools, where the Supreme Court unanimously said that parents and students with disabilities do not have to go under the lengthy IDEA process to sue for grievances if they believe that their child is not getting all of the rights and services that are protected under IDEA, and can instead sue upon the Americans with Disability Act standard. Why this bill is important is because it shows the federal government, through our waiver services and our IEP services, that this state would be taking action, that we take this 100% seriously, and we're working with families to make them live independently. And hopefully I could stop talking now, Mr. Chairman, but I think we have Santa on the Zoom.
Santa Perez. Perez9501@aol.com. Chair and committee members, thank you for letting me speak to you today. My name is Santa Perez, and I am a member of the Nevada Governor's Council on Developmental Disabilities. I would like to encourage you to approve SB 315. The ADA gave the disability community a great springboard to ensure our rights as American citizens. But we need more. As a person with a significant disability, I need my Medicaid waiver to survive. But that does not mean I have to give up my human rights. I like having choices regarding my life. They may be right, or they may be wrong, but it is my life. When people receive waivers through Medicaid, there is so much that is out of our control. The Bill of Rights for people with disabilities will ensure that we have a say in navigating our lives. We want the same things as everyone else. We want the right to choose the way we live, love, play, and work in our communities. We want our students to be informed about the services that are in their communities, so that, when they are adults, they can be informed citizens and contribute to their society. We want the best for our kids, but they need to know every available option. I hope that you consider your support on SB 315. Thank you.
And Eric Jimenez, for the record, I think that's it, and we would stand for questions.
Thank you so much. Committee members, do I have any questions? Senator Stone?
Yeah, could you please just elaborate again on that U.S. Supreme Court decision and it allows some members of this community to seek actions where they previously couldn't. Could you just clarify that a little bit? What was the name of the case again?
Yeah, absolutely. Eric Jimenez for the record. It's a new decision, so we're all digesting it. I think the Department of Education would have some thoughts, but it's Perez versus Sturgis Public Schools. And it was a 9-0 decision that just happened a few weeks ago. And what that does, essentially, Senator, is the IDEA allows a grievance process for families and students if they have a perceived violation of their rights that are protected under federal law. That is a lengthy process, so what the court decided here, I believe it was a blind student who didn't have some accessible resources. It said that they could then sue under the ADA, which is a much faster and I would argue a stronger process. So I think while the intention of this bill is not to sue anyone or our government agencies, I think it's how can we strengthen our programs now to avoid potential litigation in the future.
Appreciate the clarification. Thank you.
Thank you so much. Any other questions? I just have one question, Mr. Jimenez. First of all, thank you for bringing this. Your comments about your coordination with Regent Lieberman. He was my regent when I was at UNLV, and so I know he was a guiding light for many of us, and to see this bill is a good moment. Have you introduced this legislation before? Is this the first time the state's looking at it? If you can give us some context, that'd be great.
Yeah, Eric Jimenez for the record. This is the first time we're introducing this concept. We had some advocates come to us and say they're doing this in other states. We had conversations with Regent Lieberman before the pandemic when he passed away on kind of some structural changes that could take place, and this is really the synthesis of that. We've made a lot of progress over the last couple sessions, and I don't want to diminish that progress, but I think this is a whole new way of ways that we can look at services and providing them better.
Thank you so much. I don't have any other questions, so we'll move on to testimony and support. So once again, if you have, we'll start here in Carson City, then move to Las Vegas, and then virtually. So for folks that would like to testify in support, please come forward. And we'll proceed from this side of the room. Please proceed.
Thank you. Thank you, Mr. Chair and members of the committee. My name is Marlene Lockhart, representing SEIU 1107, and I'm very pleased to be here today in support of SB 315 and the Bill of Rights that it provides and the special new services for students. And I too would like to say that I'm honored to support a bill that Sam Lieberman would have loved to see come forward. Thank you.
Good afternoon, Chair and Committee. My name is Kiera Capurro, Kierracapurro, representing McDonald Carano on behalf of the Nevada Blind Children's Foundation. We support SB 315 and believe it will improve the livelihoods, education, and services to disabled and blind Nevadans. Recently, some of the Nevada Blind Children Foundation members visited the legislature and were introduced on both the Senate and Assembly floors. Hearing their stories illuminated the disparity of disabled children and constituents in our state. Nevada is one out of 7 states in the country without a school for the blind, making Nevada one of the most underserved states for the blind in the entire country. Some children who are blind with the public school system get placed in special education classes, while the only disability they have is blindness or visual impairment. It can take years for these students to get out of these classes, limiting their educational growth and lowering their chances of being accepted to college, a statistic that is already so low for those who are blind. We support the bill and the proposed language in the added amendment by Eric Jimenez, for the record, and especially on the extensive rights afforded to those who are disabled and respect their individualized education program within this bill, otherwise known as IEP. By recognizing and addressing these needs, you will help these individuals become more self-supporting and independent, and will save state revenue in the long run. Thank you. And thank you to the bill supporter, the bill sponsor, and thank you to Eric Jimenez.
Thank you, Mr. Chair. For the record, my name is Eddie Aveliser with Tri-Strategies, speaking to you today in support of Senate Bill 315 on behalf of Opportunity Village. We're thrilled that a bill such as this is brought forward for individuals on our waivers, individuals with intellectual and developmental disabilities, individuals that are on the physical disability and age waiver, have so many needs every single day. And a bill such as this codifies those needs and the rights embedded to them through the state to ensure that they're actually being served in appropriate ways and their voice is being heard, which is why this bill is so important. And also bringing into light the needs for our students in the education system, and particularly the transition system. We support the bill. We support the bill with the Jimenez waiver, and we want to show appreciation to Senator Scheibel and Eric Jimenez for working so diligently on this bill and bringing all stakeholders to the table. Thank you.
Hi, good afternoon, Chair Dunyate, members of the committee. Again, for the record, Will Pregman, P as in Peter, R-E-G-M-A-N, with Battleborn Progress. We are here in support of SB 315, and in particular, we want to recognize the inspiration for this bill was the titan of education advocacy and that we've all talked about, former Battleborn Progress board chair, actually, Regent Sam Lieberman. Those who are privileged enough to know Sam understand that he faced unique challenges and that he blazed a trail for the rights of people with disabilities that inspired this legislation that you see before you today. People with disabilities who receive care, among other items in this bill, should have the ability to manage their own finances, have personal records handled with confidentiality, be treated as equal citizens, and have access to the education that they wish to pursue, as well as the other parts of this bill. The rights of people with disabilities is fundamental, just as any other civil right. We urge you to support SB 315 in the memory of Regent Lieberman and for the people of Nevada. Thank you.
Chair, members of the committee, Jonathan Norman with the Nevada Coalition of Legal Service Providers. Before I was in this position, I was representing families in IEP and 504 due process cases with Clark County School District, making sure that they were receiving the education they were entitled to under federal law. And when I read this bill, I just think it's really exciting, not only for the statements about the rights they have, but also just as a tool to, when you talk with kids about where they exist in our society, right? When you can point to documents like this that shows that that they are thought of and that they have the same place and rights as everyone else in our society, it's really powerful. And I've, representing foster kids, the foster care Children's Bill of Rights. I just think they're really powerful messages in addition to what they substantively do. So thank you.
Thank you so much. Anyone else here in Carson City? Let's go to Las Vegas.
Good afternoon, Mr. Chair, members of the committee. Stephen Cohen for the record. Stephen with a V. Cohen is in the Assemblywoman, no known relation. I'll keep it short and sweet. Ditto. Thank you, and I yield.
Hello, my name is Christine Essex, C-H-R-I-S-T-I-N-E, and last name is Essex, E-S-S-E-X, and I'm here in support of this bill. I have a disabled son, and I just, actually he's incarcerated, and he has several of these issues, so if this could be taken into consideration, I might be able to advocate better for him and his rights, and that's why I'm supporting this today. And if not, I'd like to be considered for the criminal justice bill. Thank you.
Good afternoon. My name is Katrina Ojeda, K-A-T-R-I-N-A, last name Ojeda, O-J-E-D-A. I am supporting the bill. My son is on the spectrum. We need more funding for families on the spectrum and more respite and therapy for my son, so this is why I'm here to support the bill. Thank you.
Thank you so much. Anyone else in Las Vegas? BPS, let's go to virtual.
Thank you, Chair. If you'd like to testify in support on SB 315, please press star 9 or raise hand in your Zoom window to take your place in the queue.
Good afternoon. This is Connie McMullen, representing the Personal Care Association of Nevada. We would like to go on record in strong support of this bill, SB 315. Thank you very much.
Good afternoon, Chair Doniate and members of this committee. My name is Catherine Nielsen. I'm the Executive Director of the Nevada Governor's Council on Developmental Disabilities. I will start with a small piece of information that our friendly amendment you guys received today just adds our council along with Aging and Disability Services and Vocational Rehab. We are actually the entity that has been identified by the Developmental Disabilities and Bill of Rights Act to provide these tasks. So we added ourselves in there and submitted a friendly amendment to you guys as well. But people with disabilities are just that, people, and thus they should be afforded the same rights, freedoms, and protections as anyone else. Disability rights are human rights, and everyone deserves to be included in all facets of community living. Our council is authorized in accordance with Public Law 106-402 of the Developmental Disabilities Assistance and Bill of Rights Act, or the DD Act, and we're established under NRS 232.320 within the state of Nevada. The DD Act states that disability is a natural part of the human experience that does not diminish the right of individuals with developmental disabilities to live independently, to exert control and choice over their own lives, and to fully participate in and contribute to their communities through full integration and inclusion in the economic, political, social, cultural, and educational mainstream of the United States society. That people, even with the most significant disabilities, are capable of independent self-determination, productivity, integration, and inclusion in all areas of community life. This Bill of Rights for people with intellectual, developmental, or physical disabilities cements the framework our forefathers put into place when they outlined basic human rights. I applaud Senator Scheibel, Eric Jimenez, and the members of this public body for moving this piece of legislation, arguably the most important piece of legislation this Nevada legislative session, forward. If you have any questions, you can also contact our office, but I applaud you, Mr. Jimenez and Senator Scheibel, for all of your hard work.
If you have recently joined and you'd like to testify in support on SB 315, please press star 9 on your phone to take your place in the queue.
Hello, my name is Maximilian, Maxmillian. Last name is Lowe, Lowe, for the record. I'm also a member of the Governor's Council on Developmental Disabilities, but I'm calling in support of SB 315 because our rights are our fundamental freedoms guaranteed under the U.S. Constitution and to the right of life, liberty, and the pursuit of happiness regardless of who we are. This is especially important to those with a disability. Those who utilize services through social service agencies both in public and private sector have had their rights continually violated. For example, a recent example of the recent U.S. Department of Justice report on the investigation into Nevada's violation of Title II of the ADA, USC 42-12132, by denying children with behavioral health disabilities treatment in the least restrictive environment within their communities and homes. And without SB 315, the state will continue violating the rights of those with disabilities. Also, as a person with a disability and also on the community home-based waiver program and a client with Desert Regional Center, I've had some experiences with this situation. So this is why, and even as an adult, I luckily have an advocate, which is a lot of people don't realize they have the right to this. So therefore, I support SB 315. Thank you, and have a good day.
Hello, and thank you so much for this opportunity to speak. My name is Raquel O'Neill, LCSW, and the president of Blind Connect in the state of Nevada. Blind Connect is a small nonprofit that has striven to provide gaps in services for newly blind adults in Nevada since 1998. We have provided these services for this many years because, unfortunately, in the United States, when you lose something as vital as your eyesight, you are typically not sent to a rehabilitation hospital, but you are sent home. Unfortunately, this leads to a lot of misconceptions and lack of awareness surrounding vision loss in and of itself. The fear continues in individuals, and by the time they start receiving our vital services to regain independence, it is typically 6 months to 3 years on this journey of staying within their own homes, most often described as being a prisoner of their own homes due to the fear involved in losing eyesight. We are in full support of SB 315 and more. We would love to see Section G of this bill to include ancillary services that specify specific services for individuals who are blind to receive blindness-related orientation and mobility services and vision rehabilitation therapy, along with all of the other host of services listed. We want to draw attention that there is specific specialized needs for individuals with blindness in the state of Nevada, and without your support and your help, individuals experiencing vision loss will continue to stay at home and not realize their potential or their capacity for independence. Thank you so much for your support and for the ability to allow me to speak today.
Once again, if you'd like to testify in support on SB 315, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in support at this time.
Thank you so much. Let's move on to opposition to this bill. Is there anyone in this room? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in opposition on SB 315, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. And last but not least, anyone willing to testify in neutral on this bill? We have no one in Carson City, anyone in Las Vegas, and anyone virtually.
If you'd like to testify in neutral on SB 315, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for neutral at this time.
Any closing remarks?
Thank you, Chair Doñate. I believe Ms. Urchel has joined us on the Zoom to give her remarks as well, if you'd be willing to allow her to speak.
Sure, please proceed.
I think she's there. I don't see her there.
We'll try to connect with her, and maybe we could do it during public comment so we can record it, but if that's fine.
In that case, the only thing that I want to clarify for the committee is that we are absolutely here to expand services for people with disabilities, to strengthen the rights and protections that they have under law, and to provide more programming in the state of Nevada. This bill sets up the legal foundation to do that. This bill doesn't actually mandate that any state agency provide additional services that they don't already provide, but it sets up the foundation to ensure that the services they do provide are provided in a person-centered manner, and that the people they're providing the services to are involved in making decisions about their own lives and their own services, and creates that platform for future legislation to expand the services that we're able to offer to people with disabilities and students with disabilities in our community. So thank you.
Thank you so much. I'll go ahead and close the hearing on this bill, and we're going to move out of order now and do Senate Bill 390. So I'll go ahead and open the hearing on Senate Bill 390. This bill enacts provisions relating to neurodegenerative diseases. So Senator Scheibel, please proceed.
Thank you so much, again, for hearing Senate Bill 390. My name is Melanie Scheibel, for the record. I represent Senate District 9 in the southwest part of Las Vegas. And Senate Bill 390 enacts provisions and creates a registry for people with neurodegenerative diseases. I'm joined today, again, by Ms. Erin Schaefer from UNR, as well as Dr. Mindy Lokshin. And I hope that we have Dr. Jefferson Kinney on Zoom as well. We do. Fantastic. He is from the UNLV Brain Health Department, and I'll briefly review the background of this bill and the purpose of this bill. And the purpose of this bill is to create a registry that allows people with particularly Parkinson's disease, Alzheimer's, and other neurodegenerative diseases to opt in to research opportunities to allow us to better understand these illnesses and conduct further medical research so that we can start diagnosing people earlier, treating them earlier, and even in the future preventing or curing Parkinson's, Alzheimer's, and other neurodegenerative diseases. Dr. Lokshin can tell you a little bit more about how and why we connected over this bill a couple of weeks ago, or a couple of months ago, and have been working very diligently with a number of stakeholders, including the UNLV Brain Health Department, including the Department of Health and Human Services, and other people who are passionate about taking care of those of us in the community who struggle with chronic illnesses like Parkinson's. And through those conversations, we have discussed a number of different approaches to creating such a registry, and I want to let the committee know that if we are so lucky as to get a work session, there would be an amendment before that work session to conceptually address some of the questions that I anticipate you'll have about where this registry is going to be housed, what it's going to do, and how it's going to work. Because as we learned in this process, there are a number of different ways that a registry can function and can provide some real benefits to the state. And in particular with this registry, the goal is to ensure that we have a process, an avenue for communicating with people who are affected by neurodegenerative diseases, to connect them with resources and connect them with those research opportunities. And so I can walk through the sections of the bill unless you were planning to do that. I was planning to. Never mind. Erin knows it better than I do. So I'm going to turn it over to Ms. Schaefer to walk you through the sections of the bill and answer all your questions and tell you why you should vote for it and explain all of the wonderful things that we have done to make this an incredibly useful bill.
Hi again, Erin Schaefer for the record. So I'll walk you through the different sections of the bill and then hand it over to Dr. Lokshin for any last remarks. So starting with section 3 through 8 of this bill, define the terms such as healthcare facility, medical laboratory, neurodegenerative disease, Parkinsonisms, amongst other definitions relevant to section 2 through 17 of this bill. Section 9 requires the Chief Medical Officer to establish and maintain a system for reporting of information on Parkinson's disease, Parkinsonisms, Alzheimer's, and other neurodegenerative diseases as prescribed by regulations adopted by the State Board of Health. Section 9 and 10 require hospitals and certain other facilities and/or providers of healthcare to report certain information as prescribed by the State Board of Health regarding cases of neurodegenerative disease diagnosed and/or treated at the facility. Section 11 defines the procedures in which a patient may opt out of having information regarding their neurodegenerative information reported other than the diagnosis. Section 12 of this bill requires the Chief Administrative Officer of each hospital or other facility in the state to submit to the Chief Medical Officer records of the healthcare facility for certain cases of neurodegenerative diseases for the abstraction by the Division of Public and Behavioral Health, or the DBH. DPBH of the Department of Health and Human Services. This section also provides the penalty against an entity that fails to make the records available for abstraction. Section 13 states the division shall publish these reports and use the information to report and assess trends in the usage of healthcare services and the usage by neurodegenerative patients. This report must also include the locations in which patients with neurodegenerative disease reside, the information on patients diagnosed over the age of 60, amongst other provisions. Payment to DPBH of a fee established by the division by regulation to cover the cost of providing data. Section 14 provides that the chief medical officer or other qualified person assigned by the administrator of the division is to analyze the information and report to determine if any trends exist in the usage and access to healthcare services. If the administrator or designed individual determines that a trend exists in the usage and access to healthcare services for neurodegenerative patients, then they shall work with appropriate governmental, educational, and research entities to investigate the trend, advance the research, and facilitate the treatment. Section 15 requires DPBH to apply for and accept gifts, donations, and/or grants to carry out the provisions of this bill. Sections 10, 16, and 18 provide for the confidentiality of the patient's information along with that of the provider and/or healthcare facility. Section 17 provides immunity from liability for any person who discloses information in good faith to DPBH in accordance with the requirements of Sections 9, 10, and 12. So now I will hand it over to co-presenter Dr. Mindy Lokshin. She's the chair at the Parkinson's Support Center of Northern Nevada.
Thank you, Erin. Thank you, Chair Donate and committee. My name is Dr. Mindy Lokshin, Lokshin for the record. I am a family physician by training with a master's degree in public health. I'm also the family member of several people with Parkinson's disease. My father, my mother's sister, my mother-in-law passed with Parkinson's, and my sister-in-law developed symptoms in her late 30s while working as an optometrist. Putting drops in an eye is hard. Over the past several years, I stopped practicing medicine and I've become more and more involved with the Parkinson's community. I've also become better and better self-educated in many aspects of the disease. Several key points have become very clear to me. The Parkinson's community is severely under-recognized and underserved. Most people with the disease are not diagnosed for many, many years with the symptoms, and then they still have troubles finding a neurologist with expertise in the field. Although new research seems to suggest that there's a diagnosis every 6 minutes in the U.S., there are no good numbers of how many people are living with the disease. The prevalence really isn't known. And Parkinson's disease does not necessarily affect one's lifespan. It simply affects how one lives that life. Although officially there are 10,000 people with Parkinson's disease in Nevada, we estimate there are at least 3 times that number who have not been properly diagnosed, and even those diagnosed not properly treated. There is a severe shortage of neurologists. One phrase we've been using is it is a neurology desert, and with a severe shortage of neurologists, especially those with specialty training. Without good epidemiologic records, it's very hard to properly allocate resources for research, public health, or general medical care. And as we know, Nevada is one of the fastest growing states in the nation, and particularly fast growing with older population. Parkinson's disease, though, does affect people in their 20s, 30s, 40s, on up. It affects men and women. At least 10% of people are under age 50 at time of symptoms starting. That means that it affects our workforce, our parents of the young children. And it affects our veteran population. Nevada has a large veteran population. Parkinson's is associated with toxic exposures. Think Agent Orange, think burn pits. It's associated with head injuries. Muhammad Ali is the classic example, but head injuries among veterans. And it affects our rural and Hispanic Latinx population due to pesticides and other chemical exposures. When someone has symptoms of Parkinson's disease and they're not properly diagnosed, or treated. They feel scared, frustrated, and all alone. Parkinson's is a disease that is visible, unlike some, with tremor, slowness of movement, sometimes with depressed facial features. It makes it hard to go out, hard to socialize, hard to eat in public, and social isolation leads to other illnesses. This bill, SB 390, attempts to address the issues of Parkinson's disease, but it's expanded to other neurodegenerative diseases such as Alzheimer's and other dementias, Lewy body dementias, frontal lobe dementias, and other chronic problems like multiple sclerosis, ALS, Huntington's disease. All these neurologic diseases are chronic and progressive, affect people of all ages, their families, their co-workers, their businesses. The goal is to create a research registry which would greatly help determine the numbers and demographics of people diagnosed with these diseases and would allow people to opt in or opt out of participating in research so that we can find a cure or find ways to prevent all these illnesses. And only with good epidemiologic data can we hope to find ways to prevent and treat these terrible, debilitating, and isolating conditions. So I strongly urge you to support SB 390. Thank you.
I'd like to turn it over to Dr. Kinney to make a few remarks as well, please.
Thank you. So for the record, my name is Jefferson Kinney, Kinney. I am the chair of the Department of Brain Health at UNLV, and my specific area of expertise and research is the investigation of neurodegenerative disease. Primarily what we focus on is biomarkers in the disease to better identify, diagnose, and even track treatment efficacy. But in order to do this, we partner with a number of clinicians and other researchers in order to develop a very cohesive group of researchers who are able to investigate these very debilitating diseases. So I'm here today to offer my support or really lean into support for 390 because the creation of a voluntary registry provides benefits to both the advancement of research, which is desperately needed for all of these neurodegenerative diseases, but it also provides a tremendous benefit for the participants who sign up for the registry and agree to be part of the process. There are a number of other states that have established registries like this, where information is distributed and people are able to opt in to participate in the registry. It can connect them to resources, it can connect them to support groups, but also information for people who really aren't sure whether or not they should be seeing a physician. Nevada is the second fastest growing state in terms of population over the age of 65. And you heard this phrase of a neurology desert. We simply just do not have enough specialists within this field. And that provides a gap in terms of the ability to seek out and find information about what is available. And in particular, in specific communities and areas, there is a much larger gap in terms of the availability of treatment. So my support and the basic press for this is that a research registry provides the opportunity for what we call citizen scientists, for people to opt in to participate in research. And even if they don't really want to participate in the research, they have access to information about support, about community organizations, about ways to actually learn more about Alzheimer's disease or Parkinson's disease, MS. We do work related to traumatic brain injury. So there is a connection between all of these. The best examples I can come up with, so Emory University in Georgia have developed a registry like this. There's a similar system in North Carolina that has been particularly productive. And I think it's also probably worth mentioning, Nevada is a very unique place based on our demographics. There is such a good diversity of individuals in Nevada. This is a tremendous strength toward the research that will help us try and answer these questions, but it's also an opportunity for us to engage communities across the state, from rural to urban, where there are a number of really, really important questions that need to be asked, but also a number of people that want to be involved in the process of asking those questions. So our group here, as well as several other collaborators that we work with, would welcome the opportunity to work on and develop this registry because it provides an opportunity for our research. It provides an opportunity to connect with people throughout Nevada, but it also provides the opportunity for what's happening here in Nevada to be contrasted to what's happening in other states that have similar registries. There's epidemiological data that can be collected about incidence and location. There's details about specific studies, and most importantly, the availability of information to participants on what is available here, what is the progress, and a way to weave all of this together into something that really advances the science, but also advances the community in a state that has so many individuals that are at risk for these neurodegenerative diseases. And with that, I will turn it back over to Senator Scheibel.
Thank you. At this point, we are open to questions from the committee, and we have Ms. Peak with us from the Department of Health and Human Services, who can also help us if you have questions.
Thank you so much. Committee members, do we have any questions? I have questions. So perhaps this is for Senator Scheibel, and then I'll ask Ms. Peak if she's okay, more on the public health questions. Senator Scheibel, is this modeled after other states? I know California just did this in 2021. If you can share with us some feedback.
It is. It is modeled both after other states and after other registries within the state of Nevada, including the Cancer Registry and the Lupus Registry, although our vision for it is a little bit different from those registries, to be less focused on statistical data or numerical data and more focused on the research side of it. And so we've also been working with the Michael J. Fox Foundation to ensure that the kind of information that the registry would be obtaining would be useful in a multi-state effort to coordinate Parkinson's research.
So if I gather your sentiments correctly, it's not just collecting who gets diagnosed with this disease, but it's also providing them the research services that could be available to them. So it's kind of both.
Melanie Scheibel, for the record, yes, that's absolutely correct.
Thank you. Ms. Peak, I have a quick question. How many registries do we have in the state right now?
Julia Peak, for the record, that's a great question. As far as this type of registry, as the senator mentioned, I'd say there's really 4 registries that we have that are in this vein. Cancer, lupus, sickle cell, and then if this is past neurodegenerative diseases. And it's an incidence registry, but also initial treatment registry is the way it's drafted now.
Can I ask you a public health question? When it comes to disease tracking nationally, is there a means of also supporting public health infrastructure that has to come with disease tracking for this? So, I mean, I'm just asking just in general because I think it's important to have registries like this for certain initiatives, right? Which is we want to make sure, as Senator Scheibel mentioned, that when someone gets diagnosed, it's not just keeping track and reviewing why these statistics occur. It's also providing them the level of services for when the diagnosis comes. But I guess my question is, in terms of like the actual disease tracking, is that not like, are there certain parameters that we should be focusing on in general for other legislation as to what our public health mechanism can be for disease tracking? Is that a capability that we have right now? Or I guess what I'm asking is, what's the future look like for infrastructure for this particular subset?
Julia Peak, for the record, thank you for that question, and I'll try to answer, and then if I don't, please jump in. So any registry such as this should develop some level of infrastructure. So we would have a fiscal note on this to make sure that it's staffed to collect the data and provide something that's helpful. It should never be collected and put in a black hole. And so what we need, and I'm so happy that UNLV is present and others are present to actually make it actionable based on this information. What should we do? Is there prevention or intervention that needs to occur along with this? Doesn't necessarily need to be DPBH that's doing that intervention. We have many experts in Nevada that probably would utilize that data in various different ways. As far as general public health registries and then how they're used and then the data becomes actionable, the CDC is really trying to push for registries such as this. They typically come with grants. They're very competitive. I'll say sickle cell was passed, I think, 2 sessions ago to develop a registry. We're just now getting the opportunity to apply for a grant that would actually make it more robust and be able to use that information to do interventions and tell the story of the patients. I'll also add the benefit of a registry such as this, especially when we stand up like the all payer claims database, is to understand how they navigated through the system, which I think is more important information or just as important as incidence data. because we often hear from patients, they're diagnosed and then they had challenges accessing care. An all-payer claims database would help us see how they accessed care across time. So sometimes you develop a very specific incidence registry. Sometimes we're able to utilize other data sources and provide information. So there's great opportunity in whichever path is chosen.
You answered my follow-up, which was, how does this all relate to when people get diagnosed and they go through the segments of our healthcare system? How does that get collected, and how do we differentiate between what this registry would collect versus the all-payers claims database? And then the greater question, which is, if only there was a hub to collect and review what this all looks like in the long term. So that's the reason I was asking that question, but thank you. Appreciate it. Okay, I think I don't have any other questions, so we'll go ahead to support testimony. So any folks looking to testify in support of this bill, please come forward. We'll start here in Carson City, and then we'll move to Las Vegas.
Good afternoon, Chair Donate and members of the Senate Health and Human Services Committee. For the record, my name is Charles Duarte, spelled D-U-A-R-T-E. I am the Nevada Public Policy Director for the Alzheimer's Association, and on behalf of the more than 50,000 Nevadans living with dementia, their families and care partners, I would like to support SB 390, which establishes a disease registry for neurodegenerative diseases, including Alzheimer's disease. And as has been mentioned before this committee, Alzheimer's disease in Nevada, we have the third fastest rate of growth of that disease in the nation. This bill will allow the state to collect information on these diseases to further research, including research that may lead to potential treatments and cures. So again, I'm happy to support this bill and happy to answer any questions. Thank you.
My name is Ben Scheibel, B-E-N-S-C-H-E-I-B-L-E. I'm speaking in favor of SB 390. I'm not speaking on behalf of any group or association. Before I even begin, I love this, American democracy in action. The embodiment of American democracy, senators, I call it S&C, senators and citizens. But having said that, I'm a retired real estate professor at Turkey Meadows Community College and a recovering attorney. Perhaps most relevant is that I have Parkinson's disease. I didn't know this until I got it, but that affects my voice. Not always, but you can hear it's kind of a raspy voice. It affects that. If you're familiar with my last name, it's because Senator Scheibel is my daughter. It's appropriate that we consider this right now because this is Parkinson's Awareness Month. And my presentation has changed based on two things I heard here today. I believe the doctor in Las Vegas said something about opting into this. That's not what the bill does. The healthcare provider is required to provide the information to the registry. Now, that personally caused me some concern, except that there is an opt-out provision. Opt-in traditionally in any kind of system results in much more data. Very few people are anticipated to opt out. Second thing, the Alzheimer's Association says there's approximately 49,000 people in Nevada with Alzheimer's over the age of 65. And the Parkinson's Support Center of Northern Nevada says approximately 15,000 with Parkinson's. We have a dispute on that because 10,000 was quoted a little while ago. So I have an idea. If we could have a registry or something, I could provide you with more accurate and precise information on that. So those are the two things that I noticed today. This is a data-driven model for research and problem solving. That requires first that we gather the right data, secondly that we know that it's accurate, and then third that it's interpreted properly. Now the first two are served by the registry. The centralization of the data and making the same data collected will be helpful in that regard. The third one I'm not sure how to handle. I mean, the classic example of misinterpretation of data is the serious crime rate in Brooklyn, which for many years was directly correlated to a rise in the crime rate, correlated to a rise in ice cream sales. Well, you'd be a little remiss to say, we got it, we can reduce the crime rate by simply prohibiting those damn ice cream sales. It would be doing damage to correlation versus causation. So, there's no error-proof system, but I think this system, something you mentioned, Chair, that reminds me, when I worked at TMCC, my department couldn't afford a chair, so they gave us a stool. But anyway, that's beside the point. There's no error-proof system, but the centralization and consistency in the way the data is gathered, I think, will help on those first two criterion. I urge you to vote in favor of this bill. I support it. I hope you do too. Thank you. Any questions?
We appreciate your testimony. Thank you so much for joining us. Is there anyone else in Carson City that would like to provide support testimony? Let's move to Las Vegas. I see one person.
Hello, I'm Susan Proffitt, Proffitt, and I'm the Vice President of the Nevada Republican Club. And I think I am approving this. I like what you're doing here. We need it. I had to wait 6 months to see a neurologist, and my husband is now going into some dementia issues, and we desperately need to find some solutions to it. So I commend you all for making this bill possible. But I do have some questions that may put me in the neutral zone, just as the previous gentleman was asking questions. I have an issue with HEPA laws, and so because there are some people that really do need to protect their identity. And when you say they can opt out, a lot of times that information doesn't get passed on to the person that should know that, right? So, and when you talk about a hub, how are you going to be putting that information out there? And I have a suggestion, and I'm curious to know how you were going to plan on doing it. I would want to opt in, but I wouldn't want my name shared in a big database. I would want a number, a case number, something like that, that really does protect the identity of your patients. And I think you would get 100% participation if you did something like that. So that's all I have to say, and thank you very much for addressing this. We need more medical services in the state, and I see that you're making an attempt to do that. And another way to get more medical doctors to come to this state is to improve the schools quick, because they're not coming here if their children aren't going to get educated. All right, thank you very much.
Thank you so much. Anyone else in Las Vegas? We'll go to virtually.
Thank you, Chair. If you'd like to testify in support on SB 390, please press star 9 on your phone to take your place in the queue.
Hi, can everybody hear me?
Please proceed.
Hi, my name is Julia Pitcher, and I am the Director of State Government Relations for the Michael J. Fox Foundation for Parkinson's Research, and I am so thrilled to be able to come to you all through the phone tonight. I do wish that I was there in person, but I'm coming from D.C. area, and I am home with my children on spring break. But I have to just say, I normally have a very structured presentation, and everything that has been said this evening by Dr. Loshkin, Dr. Kinney, both Senator Shriebel and her dad, is spot on, and every reason why we have made this the #1 priority for state legislation for the Michael J. Fox Foundation. So I just wanted to answer a couple questions that I heard through the testimony, and you all have my written testimony. I have both a data sheet as well as a one-pager on our initiatives that was put through the portal. To answer some questions, one, there is confidentiality provisions that are provided in the bill to de-identify patients. I heard somebody say something about their name being on there. That would be de-identified, and you would become a number that would then be part of the data set. And as Ms. Peak said from the department, the job is to get the information and not just leave it in a black hole, but to publish, incidence and prevalence and figure out ways that we can connect with the community in Nevada. And then I believe there was a senator that had a question about a hub. And our longer term goal is, because this is actually going to connect with multiple states to the Centers for Disease Control, there is a hub that was passed by federal legislation many years ago, about 8 years ago, and it's known as the National Neurological Conditions Surveillance Program. It is a very long name, and their pilot project is with Parkinson's and MS, and then the goal with the federal government is to add Alzheimer's into that, and that will be a national hub for researchers to be able to do patient contact surveys, clinical trials, and other research here in this country and potentially abroad. So what we have, the guidance we have been given from the CDC is to get as many states as we can online in this year and next, and we currently have this exact bill running in 9 states, which is Oregon, Colorado, Nebraska, Missouri, Ohio, Maryland, New York, Massachusetts, and Hawaii, and now we've added Nevada, and we are hoping to pass it in as many as possible in this year, get as many in online by 2024, and then be able to go back to the CDC and say, let's flip the switch over the next year or two, and as these come online, and start to collect the data in the national hub to better give more substantive data for Parkinson's research. And with that, I'm just here to answer more questions, because everything that was said before me is fantastic testimony. And I just want to say we support, the Michael J. Fox Foundation supports the bill, and we're very much very thankful for the senator for putting it in, and we hope to have a favorable vote.
Thank you so much. Let's move on to the next caller virtually in support.
There are no more callers in support at this time.
Thank you. Anyone in opposition to this bill? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in opposition on SB 390, please press star 9 on your phone to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you so much. Anyone in neutral for this bill, please proceed forward.
Thank you, Chair Dunyate and members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record. Here in neutral today, but really appreciate and support the need for this bill, as I lost both of my grandfathers to Alzheimer's and dementia. With that being said, Senator, really appreciate your subtle suggestions on getting some kind of a hub that could house all of these registries. We would certainly support that as well, because Nevada Rural Hospital Partners has taken the time to list all of these registries and all of the public health reporting requirements on our critical access hospitals, to which there is a pretty good burden now. So if you'll go to data.nrhp.org, you can see the full list. Briefly, it includes abuse, neglect, behavioral health, blindness, burns, cancer, communicable diseases, community paramedicine, controlled substances, COVID, deaths, devices, drugs, epilepsy, finance, firearm wounds, healthcare-associated infections, hospital administration, immunizations, infectious diseases, knife wounds, lab reporting, lead, licensing, long-term care, lupus, meaningful use, MACRA, MBQIP, quality, obstetrics, OSHA, overdoses, patient safety checklist, pediatrics, pharmacy, radiology, restraints, sentinel events, sexual assault, sickle cell, state of emergency, syndromic surveillance, trauma, vital statistics, and workplace violence. So there is already a significant effort underway. Our rural hospitals struggle with that, as we often charge individual nurses with being the ones to report these items. So as we move forward throughout this process, in acknowledgement of that, it is our hope that we can reduce regulations, streamline this reporting, and get this data to where it needs to go. Thank you.
Anyone else? Let's move to Las Vegas and virtually.
If you'd like to testify in neutral on SB 390, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for neutral at this time.
Thank you so much. Any closing remarks?
I just want to thank you for hearing the bill and reiterate my commitment, and I think I speak for all of us when I say our commitment to working with the stakeholders to ensure that this registry is feasible in the state of Nevada and make it a reality. So thank you.
Thank you so much, Senator Strabel. We'll go ahead and close the hearing on SB 90 and move on to our last bill, which is Senate Bill 317. I will go ahead and open the hearing on this bill. It establishes provisions relating to resources for persons experiencing homelessness. So, Senator Strabel, please proceed.
Thank you so much, Chair Doniate. Melanie Scheibel for the record, State Senate District 9. We are coming to the end of Scheibel Day in Health and Human Services. And SB 317 is a short-ish bill that does something very important. It allows people who don't have a permanent address to utilize the address of a provider of services to the homeless as their permanent address for purposes of applying for a job, applying for benefits, applying for an ID, all of the things that get in the way of people who are unhoused being able to contribute in the ways that they want to our society that prohibit them from getting back into stable housing. This just addresses one small piece of the puzzle to hopefully help a number of folks throughout the state of Nevada be able to get back on their feet and that is the purpose of the bill. And I'll turn it over to Eric to expand a little bit on that or to provide his own comments.
Thank you, Senator Eric Jimenez with the Treasurer's Office for the record, and we will be brief because I would also like to go home at some point today. This bill is the product of something we heard on the Nevada Recovers listening tour. You all may remember when the federal government stepped up, your United States Senators Catherine Cortez Masto and Jackie Rosen, to deliver $6.7 billion in federal aid through the American Rescue Plan. 2.6 of that was more flexible dollars that we're appreciative that the legislature has prioritized. We conducted a listening tour, Treasurer Conine in our office and former Governor Sisolak across the state. It was 123 events and over 82 days in which I questioned all of my life choices up to that point. But we did meet with constituents across the state to hear and listen to them about problems that they were facing. While many of those requests were funding related, we made a commitment to folks that if there were good ideas that we heard that needed legislation, we would pursue those ideas in this legislative session. This, I will not embarrass the constituent, but this is an idea that came from a constituent in one of our Reno meetings. We had meetings with homeless service providers on housing in homeless shelters, and we heard one of the barriers for folks who are experiencing homelessness is oftentimes for certain things like enrolling their child in education, getting a job, applying for benefits. Sometimes you need an address to help streamline that process, and when you don't have an address or just have a P.O. box, sometimes that can get in the way of this process. There is limited circumstances which the United States Postal Service will authorize an individual to utilize a P.O. box, but if you think I didn't call my regional postmaster, you would be mistaken. That is a very arduous process, and sometimes P.O. boxes cannot be used for the same purposes. So broadly, this bill is meant to solve a very simple problem. It's a voluntary solution to allow people who are experiencing homelessness and receiving services from one of our nonprofit providers to temporarily use an address for limited purposes, which are outlined in Section 7. And with that, we don't want to belabor it, but it's a short bill and would be happy to take any questions from the committee.
Thank you so much. Any questions from the committee members? Vice Chair Nguyen.
And I'm not sure how this works, but I remember I had an office that was located in downtown Las Vegas, and it was near the post office. And whenever I would go to like mail things, God, I'm dating myself now because I would mail things in a post office. But when I would mail things in a post office, there was quite a bit of unhoused like population that would go there and receive like, it looked like they were receiving like Social Security disability checks or Social Security checks or other benefits. Do you know how they were possibly doing that, how they're doing that, or I don't know?
A little bit. I got a little bit of game. Eric Jimenez for the record. Like I said, the U.S. Postal Service allows for limited, the limited ability for unhoused individuals to utilize free P.O. boxes. Unfortunately, sometimes that can only take place at certain post offices, and then there's like a form you have to complete. It's a kind of a lengthy process. So while we're appreciative that the U.S. Postal Service does that, sometimes it doesn't meet the immediate needs that folks may have of like, I'm applying for a job tomorrow and I don't want it to show that there's no address on my resume or something like that. So we're hopeful this will kind of help meet people where they are a little bit and still allow them to use that USPS process, but kind of create a bigger sandbox for that.
And then my other question kind of has to do with Section 3, the definition or how Nevada resident is defined. Can you kind of describe how that is? I obviously have concerns. I know that in my private professional world outside of the legislature, identification, receiving identification, getting all that. I mean, we have bills here every session about having aiding in the ability to get your license or an ID card. Is there any reason why that was included in here, where we came up with that 6 months? I don't even think it's 6 months for other types of residency, so I'm curious on what the thinking was behind both of those provisions.
Yeah, Eric Jimenez for the record. I think this is something that kind of came out of drafting. We modeled this after something that's being done in our larger cities across the country. Notably, the city of Los Angeles kind of has a robust process in place, which you will see. That's why we have asked the Division of Welfare and Supportive Services to like publish a list so we can have people understand where they can go to utilize these services. I think we're totally open to what would meet the requirements of a Nevada resident. We're just trying to figure out what's the sweet spot of how long has someone been here, and we recognize the barriers to getting identifications, which I think in Section 3 you will see it's an or. So I think, Senator, if you have any concerns there, I think we'd be totally willing on how we can tighten that up a little bit.
Did you have any other follow-ups? No, that's all. She actually asked, Vice Chair Wayne, thank you so much. You actually asked my question. My recommendation would be, Vice Chair Wayne has a point, to differentiate as to how long you can live here to be qualified as a resident is, when you put that in statute, sometimes that could deny people the ability to receive these services. My only suggestion for an amendment would be in Section 3, it says a valid driver's license or identification card issued by the DMV. I would indicate that if they don't have that they should offer, for instance, if they are a person experiencing homelessness, but they are a resident from another country, that they could provide services or documentation from wherever they're from. And that's kind of where you would work with the consulate to make sure that those people can still receive the appropriate documentation, but maybe it's not recognized from the state, but it's still official documentation from somewhere else. So that's my only recommendation. I think the only question comes with quality assurance, and at what point is it too much of people but using this service? But I don't think that's a problem with this bill. That was just a thought that I originally had. And of course, like the backlog, but I think in the premise it's a good bill, and I think it's something that folks can utilize. And I guess my last question, or the only question I have, is the provider still has to agree to allow folks to do this, correct? That's what the bill's...
Melanie Scheibel, for the record, yes, they would have to agree to allow people to utilize the address. And I also just wanted to clarify, again, in Section 3, that because of the or language, what we're saying is that somebody doesn't have to have identification in order to utilize a nonprofit's address as their address. But if they have not been residing here for 6 months, or just one way to qualify as a resident would be to show your Nevada ID or driver's license, and then it doesn't matter how long you've been here.
Okay, thank you. Any other questions? Let's move to support testimony. Anyone that would like to provide support testimony for this bill, please proceed to come forward. Please proceed.
Good evening, Mr. Chair, members of the committee. For the record, my name is Cadence Matievich, representing Washoe County. I am here in support of the bill this evening. I'm pleased to share with the committee that at our Nevada Cares campus in Washoe County, we actually already offer this service to anyone in our community who needs an address and actually needs to receive mail. The mail is available for pickup Monday through Friday during regular business hours at the mail center at the front of the campus. We appreciate that's available for everyone and hope anyone that needs it will take advantage of it. We think that this bill provides options for those who perhaps that's not the most convenient location, may be receiving services from other providers in our community, and we support this expansion and urge your support of the bill. Thank you.
Hi, good afternoon once again. Chair Donatien and members of the committee, Will Pregman, representing Battleborn Progress. We're here in support of SB 317. We thank Senator Scheibel for bringing this forward, as well as the Treasurer's Office for hearing Nevadans during the state listening tour and working to bring this forward. This bill allows a person experiencing homelessness to use a provider of services as their temporary mailing address. Currently, people experiencing homelessness can face major difficulty applying for jobs, housing, education, receiving mail, other basic functions of living that most of us take for granted. However, these social amenities are key for someone who is unhoused, making the transition to get back on their feet, and we should be doing everything we can as a state to facilitate that transition in a positive way, especially as the economic fallout of the pandemic continues on. We thank you and urge your support to pass SB 317. Thank you.
Thank you so much. Anyone else? Let's move to Las Vegas and virtually.
Thank you, Chair. If you'd like to testify in support on SB 317, please press star 9 on your phone to take your place in the queue.
Good evening. This is Dora Martinez with Nevada Disability Peer Action Coalition. We are in support of this SB 317. As a blind mom with 5 children, when I first came to America, we found ourselves homeless and like 10 years ago, and we were in need of a physical address and all that. And one of the native homes provided us with a letterhead, and we brought it to the services that we needed, and we got support from that. So this is a common sense bill and a long time needed bill for the state, and we thank Senator Scheibel for providing it. Thank you.
Chair, there are no more callers in support at this time.
Thank you so much. Anyone in opposition to this bill? Anyone in Las Vegas and anyone virtually?
If you'd like to testify in opposition on SB 317, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you so much. And anyone in neutral on this bill? Anyone in Las Vegas and anyone virtually?
If you'd like to testify in neutral on SB 317, please press star 9 on your phone to take your place in the queue. Chair, there are no callers at this time.
Thank you so much. Senator Scheibel, any closing remarks? Nope. All right. We'll go ahead and close the hearing on this bill, which brings us to our last agenda item, public comment. So are there any individuals that would like to provide public comment at this time in Carson City? Anyone in Las Vegas? And virtually.
If you'd like to participate in public comment, please press star 9 on your phone to take your place in the queue. Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. I'll go ahead and close public comment, and that concludes our meeting. We have our meeting being scheduled at a different time on Thursday, so the agenda should be posted as a reminder. But thank you so much for joining us, and the meeting is now officially adjourned.